Today we are going to discuss about incidence and prevalence. The incidence rate defined as number of new cases in a group of people in a specified period or time. Incidence rate is the rate, so it has a numerator and a denominator. So incidence rate formula is numerator would be number of new cases in a specified population or we can say specified group or population divided by number of population at risk. For example, we have a group of 20 people. If we want to calculate incidence rate, we have to specify the time, for example, per year. If we know that there are 5 cases of a specific disease, for example, TB, in this group of 200 people, so incidence rate would be 5 divided by 200, and yes, we can calculate the rate per number of people. So it could be percentage wise, or how many cases, or what is the incidence rate per 100,000 people. For example, incidence rate here is 0.025, which is 2.5 per 100, or 2.5%, or if we count out of 100,000 people, we have to multiply that number with 0.025 into 100,000 people is 2,500 per 100,000 people. That is the incidence rate. So now we are going to know what is attack rate. Okay, attack rate is attack rate. Attack rate, this is also a incidence, but this is cumulative incidence. Cumulative incidence of a disease cases in a group of people who are at risk, of becoming ill, or who are exposed to risk factor. So this attack rate actually used for during an outbreak, for example. During an outbreak, how many new cases happen from the beginning of the outbreak to the end of the outbreak? If we count all these cases, that would be the attack rate. For example, those cumulative cases would be um, attack rate. Suppose there are 20 cases during an outbreak of norovirus, um, and the total people exposed to the suspected risk factor is, or suspected food is 1,000. So during the outbreak, total number of cases were 20. So the attack rate would be 20 divided by 1,000 into 100 percentage. That would be 2% attack rate. Next, we are going to talk about prevalence. Okay. Prevalence is number of all cases of a disease in a population or group of people, or a group of people. Here also we need to specify within specified time, right? Time. So here number of all cases that includes already existing cases plus new cases happen in a specified time frame. This time could be a point of time or a period. For example, 5 years, within 5 years or within 1 year, that need to be specified. Okay, so I'm going to draw something, it's called a prevalence spot. Okay, the prevalence spot look like this one. It has uh, some drains in it, and it end up going to this well or the pot or the vessel that has that getting the flow of cases, okay, inside that vessel. So this vessel also have some drains. Um, these vessels here, this pot here is the make me nice. Okay, it's the total population at risk. Total population who are at risk. Risk of becoming a disease. And this line here, this opening here, it contain incident cases or the new cases. These new cases is flowing through this, um, flowing and up and added to this pot or the the vessel here. that contain new cases plus existing cases. So this is the prevalence or the prevalent cases, which include new plus existing cases. XIS, existing case. From these cases, the number of prevalence cases can only be reduced when somebody die, mortality, somebody recovered. Some people may recover, but without any immunity, so they will add it to the people at risk. But some people who recovered with immunity, they will not be added to the people at risk because there is less possibility that they will get sick again. Thank you. That's all for today's discussion.